So as the third wave of COVID-19 infections progresses, health authorities are scrambling to ensure that services will meet the increased demand. With space at hospitals filling up and oxygen supplies running out, healthcare professionals are desperate for any help. Let's unpack the story for you and I'll give you a real picture of what's unfolding on the ground. We're joined by Tembisa Hospital's acting CEO, Dr. Mthunzi, and also the Chief Director for District Hospital Services, Ramphelane Morewane, this morning. To both of you, a warm welcome. Thanks for coming on to the AM report. Dr. Mthunzi, I want to begin our discussion with you this morning because there has been so much back and forth on the real situation at hospitals, specifically in Gauteng. Give us a picture of the situation at Tembisa Hospital.
Thank you, Michelle, and good morning to yourself and your viewers. The situation currently is dire. Mm-hmm. Why I say it's dire, we are really busting in our seams, purely on the basis that the demand for services, and you've rightly said, the demand for oxygen, the demand for beds, A&E beds, outstrips supply. Yeah. Yes, what is happening is that, and remember, we've been agile. We've created beds that are for COVID-positive patients, but COVID-positive patients, they still have to go through A&E. And we are not oblivious to the fact that we had a high burden of disease, and we've got what we call the quadruple burden of disease in our country, and trauma also plays a role. Trauma has not taken a back seat, so all these they add to the load and the demand outstripping supply.
Give us a sense, Dr. Mthunzi, of the number of dedicated COVID-19 beds at Tembisa Hospital to treat people who are suffering from serious illness due to the virus. And, you know, at the same time, how many additional beds you could do with?
Yeah. Michelle, this is how it is. We've created 151 beds for COVID-19 positive patients. The challenge is still actually in the A&E space, and we're talking about where accident and emergency. Mm-hmm. Now remember, a COVID-positive patient might be there for a day or so, and purely on the basis that the results will then be available in 2 days or so. So the problem is not really the beds that we have created, the actual beds for COVID-19 patients, but it is actually the demand on services, particularly at A&E space, because trauma has not subsided. Internal medicine patients have not taken a back seat. All of us somehow actually we feel that we are strained, purely on the basis that this COVID-19 finds us when we have a high burden of disease.
Yeah. Ramphelane Morewane, let's bring you into the discussion now. You're with District Hospital Services. Is the picture at Tembisa Hospital, is it isolated, or is this a situation that you're seeing across hospitals in the province?
Michelle, good morning, and good morning to your viewers, and good morning, Dr. Mthunzi. The picture would vary from area to area, depending on where the upsurge of cases is. If, for an example, we talk about Tembisa Hospital, which is in Gauteng, as you know, yes, the situation will be that dire, but because we haven't stopped seeing ordinary patients, particularly at the A&E, as he says, what we did was from the beginning, we asked that there be dedicated beds for COVID-19. But we later then realized that the number of beds that had been repurposed for COVID-19 may not be enough at the time that we really hit a peak. Then the decision was we should make as much bed available as possible for admission of COVID-19 patients, because we knew that we were going to come across this kind of problem. Now, of course, our resources are not finite, so we're running a system with resources that are limited. So all we can ask is that if people were to conduct themselves very well, behave and observe all the laws, it will not see these numbers. Because, Michelle, as I can tell you now, the situation we sit with is, at the hospital level, we are at the upper end of the stream, where people end up there when one or two family members or friends or relatives or colleagues at work have not conducted themselves very well and have infected many people. So we end up with this admission. So the situation indeed will be like that. And I can tell you it will get worse as long as these numbers keep on rising. But we have on our side, have made sure that there's adequate number of beds, have made sure that there's adequate supply of oxygen. But of course, as I said, there's another resource that you can't expand beyond where it is. It's going to be a human resource that you can't expand. It's going to be the walls that you can't expand. Because when we talk about a functional bed, we're not talking about a bed, a mattress, and a frame. We talk about a complete functional bed with human resource equipment and every other commodities that are required for that bed. So basically, that's the picture that I can paint for now. Thank you very much.
Dr. Mthunzi, I know that you need to rush off very quickly, and understandably so. You have your hands full at Tembisa Hospital. But before we let you go, give us a sense of what your plea would be to government at this stage of the pandemic, in terms of whether government has planned sufficiently to battle the third wave of infections.
Michelle, thank you for that. The first wave, found us, at our back foot. Somewhat, actually, we planned better for the second wave. The third wave, we showed agility as a health system. And I think we need to applaud, a government on that. The plea would be the public, as Ramphelane Morewane is saying, to the public, is to say that the fight on COVID-19 cannot actually be won by government only. We need to then put all hands on deck. All regulations that are put to safeguard us must actually be observed. A simple thing like your social distancing, avoiding super spreader events, issues of sanitizing and washing of hands. It can sound very simple and it can sound monotonous as well, but it is actually something that would ensure that our positivity rate goes down, our admission rate goes down. We are pleading, and also we are pleading to say that stricter regulation, lockdown regulation, I think actually it's something that needs to be explored. In the coming week, 2 weeks from today, we will be on 100% utilization. So we are seeing it, and we are on the ground. We are saying to ourselves, let's sound the call to everyone to say that let us actually ensure that we take part in addressing the issue of COVID-19.
Dr. Mthunzi, I'm going to stretch it for a second and ask you one more question. 1 year and 3 months into the lockdown that was announced by the President on the 27th of March, 2020, how have your staff been coping with the first, second and third wave of infections? How are they doing mentally?
It has been strenuous, but there are systems in place, and we ensure that occupational health and safety is priority. And you must remember that National Health Department, under then the leadership of Dr. Zweli Mkhize, instituted an instruction to all facilities to say that let's hold occupational health and safety meetings on daily basis so that we are able to involve wellness, we're able to debrief, because you can imagine you having people next to you as a frontliner, some actually passing on due to this very same COVID-19 when they were caring for a patient. So you would understand those who are remaining since March 2020, who are still in the front line, have that resilience, had to go through rigorous debriefing. It has taken a toll on staff. But I welcome the move by Gauteng as well to ensure that we are augmented in terms of staff. The South African National Defence Forces assisted us, or is assisting us, in the process of assisting us to be able to get through this third wave.
Dr. Mthunzi, thanks very much for your time this morning. We appreciate it. We're going to let you go there, but we'll continue our discussion with Ramphelane Morewane, who joins us as Director for District Hospital Services. Ramphelane, I want to talk to you about the 96% occupancy we're seeing in hospitals in Gauteng. But before we do that, let's listen to this soundbite from Imtiaz Suleiman from Gift of the Givers. He describes what he sees at hospitals around the province.
Frightening in the third wave is that doctors are calling for oxygen, not patients to that extent. When doctors are saying, like in the last 48 hours, well, let's put it this way, on Sunday, we got so many calls for oxygen concentrators. So we asked, but you guys had oxygen concentrators in the first and the second wave. Where are they now? The one guy said, we've already used 140, and we're way behind what we require. And this is a doctor. And he says we probably need another 500 to 1,000. That's from one area of Joburg. I get a call from other areas of Gauteng to say we use 100, if they're not coming back, people are still sick. We need another, we need another 40 or 50 more immediately. And the similar calls comes from other parts of Gauteng to say, look, we are in serious trouble. So then doctors call. They say, we are physicians. Can we put up the patients in a hall? So I said, why do you want to do that? They said, there's no hospital beds. So I said, are you going to take responsibility of this patient after 4 o'clock in the afternoon? Are you going to be there the whole night? And if there's not one 10 or 15, are you going to look after all those patients? The physician says, no, I can't do that. So I said then, safer to leave them at home with their families. And we can't bring families to the hall because that will become a super spreader event. Unfortunately, South Africans are not disciplined. So you know what, you're going to have a problem where the super spreader events in the hall. So I said, what's the requirement? They said, look, we need oxygen in hospitals, but there's no hospital to go to. There's no beds. The casualties are full. All we can do as physicians and GPs is go to people's homes. Now that's a huge strain.
Really a dire situation described there by Gift of the Givers, who an organization itself who has donated oxygen tanks to a whole range of hospitals around Johannesburg. Ramphelane, as we approach the peak of the third wave of infections, we're told we're 2 weeks away still from the peak in infections. What are some of the emergency measures that are being put in place to assure that all of these issues are addressed, particularly the need for oxygen?
Michelle, I don't want to respond to Dr. Suleiman's voice clip. I don't want to be engaging, but let me just say this. When we are in a crisis, I think we need still those that are at work, we need to coordinate our interventions. We need to know which areas, which doors we're going to knock at to make sure that we get the solution to the problem. Otherwise, we're going to be hitting each other's heads, batting each other's heads as we go along the way. Dr. Suleiman rightfully says they were able to distribute oxygen concentrators where they were required. We're calling on both the private and public sector to work together so that when you talk about the number of beds that are full, we say if they are full at both public and private sector and see how collaboratively we can relieve each other's pressure where there's a pressure. So I would then call unto anyone who has a solution to approach the provincial department or even come to National Department of Health and say, we think we can do this. It does not matter what time of the day it is. We should be able to respond. Now, I hear that that frustration is actually getting escalated and it's getting more intensified. Now, the advice I can give is, let's do that. The second thing is that from where we're sitting, we are now in the third wave in Gauteng, and we may be approaching the third wave in other provinces. We have lined all our resources. Oxygen production is increasing. Our service providers assured us that there will be maximum supply. There will be increased number of tankers on the road to distribute oxygen. But at the end of the clip by Dr. Suleiman, if you can hear, while people say there's no oxygen, they also accept that there's actually no bed. Because even if you can bring tons and tons and tons of oxygen, if there's no bed, there's nothing you can do. So the real problem is the shortage of bed. But we need to examine. Is it a private sector and public sector together that where we can say there's completely no bed at all? So we'll go back and engage our colleagues in the private sector. We'll engage Dr. Suleiman so that we know exactly in those hospitals where the problems are and be able to deal with it. If this problem comes from individual doctors, we'll encourage that through their either hospitals or clinical management teams, through some mechanism, we coordinate it. It does not help for everybody to want to do everything in an uncoordinated manner. So that's where the problem is. And I can tell you, if you go into the third wave in a very uncoordinated way, we'll definitely get defeated. So we definitely need a well-coordinated approach. So everybody must talk to the right people. And if they can't find the right people, offline, I can give you my contact details. I can give you my email address so that we're able to hold each other's hand and march on and defeat this scourge that's actually engulfing the country.
And of course, it's as our frontline workers have been telling us as well, it's not just up to government, it is up to how individuals behave in terms of adhering to those non-pharmaceutical interventions. Ramphelane Morewane, thanks very much for your time this morning on the AM Report. He's Director for District Hospital Services.